Read updates in Chinese. Americans should brace for the likelihood that the coronavirus will spread to communities in the United States, the Centers for Disease Control and Prevention warned Tuesday. It's not so much of a question of if this will happen in this country anymore but a question of when this will happen, said Dr. Nancy Messonnier, director of the National Center for Immunization and Respiratory Diseases. She said that public health officials have no idea whether the spread of the disease to the United States would be mild or severe, but that Americans should be ready for a significant disruption to their daily lives. We are asking the American public to prepare for the expectation that this might be bad, Dr. Messonnier said. The Secretary of Health and Human Services delivered an equally sobering message on Tuesday. The Secretary, Alex M. Azar II, told a Senate committee, "This is an unprecedented, potentially severe health challenge globally. We cannot hermetically seal off the United States to a virus," Mr. Azar said. "And we need to be realistic about that. Federal and local health departments will need as many as 300 million masks for healthcare workers and additional ventilators for hospitals to prepare for a major outbreak of coronavirus," he said. On Monday, the Trump administration requested $2.5 billion to help stop the spread of the virus. Lawmakers from both parties made it clear they were unconvinced the Trump administration was prepared. When Senator John Kennedy, Republican of Louisiana, pressed for an exact number on people expected to be infected, the acting Secretary of Homeland Security Department, Chad F. Wolf, could not answer. "I'm all for committees and task forces, but you're the secretary," Mr. Kennedy responded. "I think you ought to know that answer." President Trump, speaking earlier in the day from India, said that the United States was well able to protect itself against the spread of the coronavirus and offered an optimistic outlook. "I think the whole situation will start working out," Mr. Trump said during a news conference. Watch the video. The virus has infected more than 81,000 people in China and 38 other countries. A clinical trial has begun in Nebraska to test whether an experimental drug can treat the new coronavirus, starting with an American who was quarantined on the Diamond Princess cruise ship in Japan, the National Institutes of Health said on Tuesday. Meanwhile, the Food and Drug Administration said it was closely watching the supplies of 20 unrelated drugs that are either made in China, where the epidemic has drastically reduced manufacturing, or contain ingredients from China. The agency did not say which drugs, but the world relies heavily on China for supplies of many essential medications like aspirin and penicillin. In the trial, the patient is being treated with the drug remdesivir, an antiviral developed by Gilead Sciences. The test is taking place at the University of Nebraska Medical Center in Omaha, which has a special biocontainment unit, according to the National Institute of Allergy and Infectious Diseases, part of the NIH. 13 people from the ship have been taken there for treatment. There are no approved treatments for illnesses caused by coronaviruses, including the new one, known as COVID-19. Remdesivir is already being tested in 2 clinical trials in China, but efforts to enroll patients there have faltered. "We urgently need a safe and effective treatment for COVID-19, said Dr. Anthony S. Fauci, the director of the Allergy and Infectious Diseases Institute, at a briefing at the Department of Health and Human Services. Several companies are also working to develop a vaccine for the virus. One of them, Moderna, said Monday it had delivered an experimental vaccine to the NIH for early testing in humans, a record-setting pace. Updated February 25, 2020. But, even at rocket speed, releasing a vaccine would take at least a year, Dr. Fauci cautioned. He projected that initial human trials would begin in a month and a half, with about 45 people, and last 3 to 4 months. Then it would have to be expanded to hundreds, if not thousands, of subjects in countries with active disease transmission, which would take 6 to 8 months, he said. A day after its worst one-day slide in 2 years, the S&P 500 fell 3% by Tuesday afternoon in response to the coronavirus threat, a decline that put the blue chip index firmly in the red for the year. the yield on the 10-year Treasury note fell to a record low, a possible sign that investors expect growth in the United States to slow. Investors continued to dump stocks a day after the S&P 500 lost 3.4%, after officials in Italy and South Korea reported new infections on Monday. Tuesday's decline came as federal government officials warned that the epidemic was likely to reach the United States with potentially severe impacts. For weeks, U.S. investors had largely shrugged off the economic risks of the virus even as it disrupted global supply chains and shut down factories in China. As recently as last Wednesday, the S&P 500 was at a record high. Fears have grown stronger about the viruses on the global economy. The declines in the S&P 500 were led by energy, industrial, and materials shares, the sectors of the market closely tied to Chinese demand for raw materials. As stocks dropped sharply, investors moved into the safety of government bonds, pushing their prices up and yields down. A coronavirus outbreak in Italy, the worst outside Asia, appears to be spreading. New cases, most linked to the Italian epicenter, Lombardy, were reported on Tuesday in Spain, Austria, Croatia, Switzerland, and France. The authorities in Algeria reported their country's first confirmed case, an Italian, though it was not immediately clear if the person had been in Italy recently. Italy reported a total of 322 infections through Tuesday, up from 229 a day earlier, with reports of new cases in Tuscany and Sicily. The death roll rose to 10, from 7. Austrian authorities said two 24-year-olds from Lombardy living in Innsbruck, Austria, had tested positive. A 36-year-old Italian woman living in Barcelona tested positive after returning from a trip to Lombardy, according to Spanish authorities. They are also dealing, on the island of Tenerife, with a couple from Lombardy who are both infected. A man who visited Milan in mid-February has become Croatia's first confirmed coronavirus patient, the Croatian Prime Minister, Andrej Plenković, said in a news conference. France announced 2 new cases, one a young Chinese woman who arrived in early February and the other a Frenchman returning from a trip to Lombardy. The reports added to fears that the virus could spread rapidly across the continent, where the Schengen zone allows largely free movement among 26 countries. Olivier Véran, France's health minister, said after a meeting of European health ministers that they were working on a collective strategy. As of now, we wish to be extremely clear on the fact that there is no reason to close the borders between our countries, which would be disproportionate and inefficient, he told reporters in Rome. Italy has installed checkpoints and deployed its army to the red area in Lombardy, Michele Capone, a Carabinieri official, told the Italian news agency ANSA. With public gatherings restricted, the soccer team Internazionale of Milan will play its home game on Thursday, against Ludogorets of Bulgaria, without fans in the stadium. In southern Italy, the region of Basilicata has said it will quarantine arriving northerners, while the regions of Puglia and Calabria have asked travelers from affected areas to inform the local authorities. Prime Minister Giuseppe Conte said on Monday that such restrictions were not justified. The government of Croatia took pains to emphasize its preparedness and Project Calm. But the virus's emergence in the Balkans could test poorly funded health systems, which are hemorrhaging medical professionals bound for Western Europe. Budapest Airport announced that it procured a thermal camera last week and would rent another to screen travelers for fevers, while experts warned that Hungary was ill-equipped for an outbreak. Ferenc Faluz, a former chief medical officer of the country, said, "We are in deep trouble if the virus comes to Hungary." China's battle to contain the deadly coronavirus epidemic showed new signs of success, with a plunge in the rate of new infections. But that news was overshadowed by the unbridled expansion in Iran, South Korea, and Italy, underlining the threat of a global pandemic racing out of control. The World Health Organization said that the pace of confirmed new cases in China, which exceeded 2,000 a day a month ago, had dropped steadily, to a low of 508 on Monday. It said the severe measures imposed by the Chinese authorities to isolate patients in the hardest hit areas had likely prevented hundreds of thousands of additional infections. The city of Beijing has imposed new rules on workplaces, including one that prohibits workers from eating face-to-face. No more than half of an office's employees should be at work on a given day, they must keep at least 1 meter apart from each other, each must have at least 2.5 square meters of working space, and elevator capacity cannot exceed 50%, the city said. But while China appears to be having some success in managing the epidemic, WHO officials have warned that the world at large is unprepared for a leap in infections, which could overwhelm medical resources in many countries. They also cautioned that new cases could suddenly resurge in China, as the government struggles to get people back to work. By Tuesday, South Korea had reported a total of 977 cases, the second most in the world, and the Centers for Disease Control in the United States warned Americans not to travel there. Most of the cases reported by South Korea's Centers for Disease Control and Prevention continue to come from Daegu, the city at the center of the outbreak in that country. In Iran, a spike in coronavirus infections, including the top health official in charge of fighting the disease, has prompted fears of a contagion throughout the Middle East. In Italy, one of Europe's largest economies, officials are struggling to prevent the epidemic from paralyzing the commercial center of Milan. And in New York, London, and Tokyo, financial markets plummeted Monday on fears that the virus will cripple the global economy. The emergence of Italy, Iran, and South Korea as new hubs of the outbreak underscored the lack of a coordinated global strategy to combat the coronavirus, which has infected nearly 80,000 people in 37 countries, causing at least 2,600 deaths. A hotel on the Spanish resort island of Tenerife was locked down under a police cordon on Tuesday after an Italian guest and his partner tested positive for the new coronavirus, the authorities said. Around 1,000 guests are booked at the hotel, the H10 Costa Adige Palace, at a resort that is popular with British tourists. Tenerife is the largest of the Canary Islands, off the coast of West Africa. The first patient, a doctor, had been on Tenerife for a week before he fell ill with a fever. He checked in at a local hospital, where he tested positive on Monday night and was placed in an isolation ward. His partner tested positive on Tuesday, health officials said. The Spanish authorities said that more tests were being done in Madrid to confirm the diagnosis, and they ordered guests at the hotel not to leave until they were complete. For those guests, it would be hard to imagine how their vacation could get worse. Over the weekend, a storm swept sands from the Sahara over the Canary Islands, forcing airports to close and stranding thousands of tourists. Spain previously confirmed 2 cases of the virus, both foreigners who were hospitalized on Spanish islands, a German citizen on La Gomera and a Briton on Majorca. Iran's deputy health minister, Iraj Harichi, who has spearheaded the country's efforts to contain the coronavirus, has contracted the illness, the health ministry said on Tuesday, renewing concerns about the spread of the virus in a country that has become a focal point of the epidemic. In an interview with the state-run news outlet IRNA, a spokesman for the ministry said that Mr. Harichi had been experiencing weakness and flu-like symptoms on Monday before holding a news briefing, and tested positive for the virus later in the day. During the briefing, Mr. Harichi could be seen repeatedly wiping sweat from his brow and shifting from foot to foot. On Tuesday, he posted a video from home detailing his diagnosis and self-quarantine. A prominent member of parliament, Mahmoud Sadeghi, posted on Twitter that he also had the virus. Health officials quoted in Iranian state news media confirmed 3 more deaths, bringing the country's total to 15. At least 95 people nationwide have tested positive for the coronavirus, most of them in the northern city of Qom, health officials said. Qom is an important religious center that draws millions of visitors annually, many from abroad. Experts fear that the government may be concealing the true scale of the problem, and may not have the capacity to respond effectively if things begin to spiral out of control. President Hassan Rouhani, in a televised speech, blamed Iran's enemies for sowing panic in an attempt to shut down the country. "This is one of the enemy's plots to create panic to close down our society," he said. "No, we all have to work, carry on with our activities, and be careful, and take the sick to the hospital." With an economy choked by economic sanctions, a restive population that distrusts its government, and a secretive leadership, Iran is something of a wild card in the region. Calling the coronavirus a plague, an Iraqi lawmaker demanded on Tuesday that the government seal its borders with Iran until the disease is completely controlled, the same day that Iraq's health ministry announced 4 more cases of the virus. The demand, by Qutayba al-Ubari, chairman of the Iraqi parliament's Health and Environment Committee, came as governments across the region sought to limit the entry of Iranian travelers following an outbreak in that country that has killed at least 15 people. The Iraqi government said it would suspend all flights from Iran beginning Monday afternoon, but by Tuesday morning, flights were still scheduled to and from Najaf, a central Iraqi city that is home to Shiite shrines popular with Iranian pilgrims. Iraq reported its first case of the virus on Monday, a 22-year-old religion student in Najaf. On Tuesday, the health ministry confirmed that a family of 4 from Kirkuk who had just returned from Iran had contracted the coronavirus. The government told citizens to avoid crowded places including shrines, universities and schools, shopping malls and stores, sports activities and entertainment parks. Officials recommended avoiding kissing or shaking hands with others and urged people to use disposable napkins. The firebrand cleric Moqtada al-Sadr said he would suspend vast protests against his political opponents. "I had called for million-man protests and sit-ins against sectarian power-sharing, and today I forbid you from them for your health and life, for they are more important to me than anything else," he said in a statement. Other nations in the region issued travel restrictions on Tuesday. The United Arab Emirates, home to Dubai International Airport, one of the world's busiest, has suspended all flights to Iran. Bahrain, which confirmed 2 cases in travelers who had flown from Iran via Dubai, said that it had suspended all its flights from Dubai International Airport and from Sharjah International Airport, also in the United Arab Emirates, for 2 days. American citizens were advised on Monday to avoid non-essential travel to South Korea because of the rapid spread of the coronavirus there. The U.S. Centers for Disease Control and Prevention has raised the travel warning to level 3, its highest warning. There is a widespread, ongoing outbreak of respiratory illness caused by a novel, new, coronavirus that can be spread from person to person, the CDC said in an advisory. Older adults and people with chronic medical conditions may be at risk of severe disease. The CDC also warned that there is limited access to adequate medical care in affected areas. The warning came as South Korea reported Tuesday that the number of cases in the country continued to climb fast, reaching 977, up from 156 on Friday. The majority have been centered in the area in and around Daegu, South Korea's 4th largest city, 180 miles southeast of Seoul. And roughly half the patients in the country are members of the Shincheonji religious group, a church that has a large following in the city. President Moon Jae-in has put the country on the highest possible alert in its fight against the coronavirus. But Daegu has not resorted to the kind of strict lockdown China has imposed on its hardest-hit places. Though the shops, offices, and restaurants of Daegu are unusually empty, they are open for business. Reporting and research was contributed by Raphael Minder, Matt Phillips, Russell Goldman, Megan Specchia, Emma Bubala, Melissa Eddy, Joseph Aravic, Benjamin Novak, Keith Bradsher, Gary Mullany, Amy Ortiz, Alyssa Rubin, Elaine Yu, Mark Landler, Stephen Lee Myers, Sui Lee Wee, Farah Stockman, Louis Keene, Noah Wieland, Emily Cochran, Maggie Haberman, Pam Bellook, Noah Wieland, Katie Thomas, Elian Peltier, Ko Sang-hun, Nvul Sheikh and Farnaz Fasahi.